am Sneha, lecturer, Department of Physician Assistant, SNS College of Allied Health Science. Today we are going to see about wound care. Before entering into the topic, let me explain what is wound. Wound is a cut or injury to the skin which damages skin, mucous membrane and also internal structures. It can be classified into two types. The first one is open wounds, the second one is closed wounds. We will see what is wound care. Wound care is a systemic approach to promoting optimal healing, preventing infection and minimizing complication. If we do not give proper wound care, the wound will lead to infection and further complications. So we have to minimize the complications and also risk. It can be done in both the hospital setup and also community health setting. Here is the image of wound care. Principles of wound care. The first one is assessment. Before doing the wound care, we have to assess the wound type, wound location, wound size, wound depth and stage if applicable. Then we have to classify the wound into three types. The first one is clean wound. Clean wound carries less microorganism and also it heals in shorter duration. The next one is clean contaminated wound. It carries some microorganism and it also lead to contaminated wound. The third one is contaminated or infected wound. These types of wounds already have some amount of microorganism and also it lead to further complications like necrosis, tissue damage and tissue death. Then we have to assess the signs of infections, necrosis and also poor healing. The next one is preparation. For wound care, we have to inform the consent for the patient and also explain the procedure to the patient. First, we have to explain proper procedure, what we are doing to the patient and also get consent from the patient. Then only we have to do wound care. Next is perform hand hygiene, prepare a sterile or work surface, clean work surface. In hand hygiene, the healthcare provider should thoroughly wash their hands before doing the wound care. Next one is gather all necessary supplies to do wound care such as sterile dressing pack, cleansing solution, dressings and also instruments. In stage 1, step 1, the healthcare provider wash their hands. In step 2, the healthcare provider will cleanse the wound of the patient. In step 3, healthcare provider cleanse the surrounding skin also. In step 4, the healthcare provider will do proper dressing. In cleaning, clean the wound and the surrounding skin with normal saline or water. The healthcare provider should wash the surrounding skin also because it also carries some microorganisms. Then the healthcare provider should avoid harsh chemicals like alcohol as they can damage the tissue of the patient. Irrigate contaminated wounds at high pressure to remove debris. Wound carries debris. Debris means unwanted content. So we have to remove for quick healing. For infected or necrotic wounds, the surgeon or physician will perform debridement to remove dead tissue because the dead tissue will not give space for healing. So we have to remove the dead tissue. For dressing application, apply an appropriate dressing to maintain moist wound environment and protect against contamination because dry wound environment will lead to irritation and also further damage. So we have to maintain the moisture in the wound surface. Next, the healthcare provider use sterile technique and ensure the dressing covers the wound adequately because proper wound dressing will help for proper healing. Then secure the dressing with tape or bandages as needed. For follow-up, the physician should document the wound assessment and care provided for that wound and also any changes in wound status. Then the physician will explain the patient signs of infection such as discharge, any other swelling, pain, irritation, that and all. Schedule regular dressing changes and reassess the wound at each visit. There are three types of wound closure. The first one is primary closure. This type of closure is used for clean wounds because it takes less time to heal. The edges are approximated with sutures, staplers or other strips which is comfortable for that kind of wound. Next one is delayed primary closure. This type of closure is used for clean contaminated wounds because this kind of wound need initial cleaning and debridement, then the physician will close after some time. In secondary intention, it is used for contaminated or infected wounds which are left open to heal naturally, because it has some microorganism and also debris. The physician will remove the debris to give space for healing, and also do regular dressing and debridement to promote wound healing. There are 4 stages in wound healing. The first one is hemostasis. Immediate response to stop bleeding our body will do. Next one is inflammation. Body's defense against infection or debris. The third one is proliferation. In this stage of wound healing, our body will create new tissue and blood vessels to promote healing. The fourth one is remodeling. Our body strengthen and mature new tissue and also provide proper surface. This is the image of wound healing. The first one is hemostasis, second one is inflammation, third one is proliferation, and also fourth one is remodeling.